The mission of the Pandemic Emergency Board is to provide recommendations to deal with the major global challenges arising in response to an unfolding pandemic. The board is comprised of highly experienced leaders from business, public health, and civil society.
A dangerous virus is spreading rapidly in China, and U.S. officials are very worried that it could come here. China has more than 200 confirmed cases of coronavirus, it's called, which produces pneumonia-like symptoms.
It began in healthy-looking pigs, months, perhaps years ago. A new coronavirus spread silently within herds.
Authorities say most of the cases link back to this now shuttered animal and seafood market in Wuhan.
The strain of the coronavirus has been spread to humans through exposure in handling of animals at the market.
Respiratory illness with symptoms ranging from mild flu-like signs to severe pneumonia. The sickest required intensive care. Many died. Experts agree unless it is quickly controlled, it could lead to a severe pandemic, an outbreak that circles the globe and affects people everywhere.
U.S. health officials are concerned this rapid spread could mimic the massive SARS outbreak of the early 2000s, which resulted in 774 deaths in 29 countries.
We could be looking at double the number of cases in 1 week and 16 times as many in a month if we are not able to stop the spread. That would be on the order of 500,000 cases, and it would continue to rise exponentially.
Guess what, bitch? Coronavirus! 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 Guess what, bitch?
We have known about caps-like viruses in animals and people for decades, but have not been successful at developing a licensed vaccine. And sure, there are new technologies that may help, but it's going to be difficult. I am not optimistic about having a vaccine in time to be relevant during this pandemic.
Doctor, if you were a betting man, when would you bet that we would we would have a vaccine?
That's a very difficult question to answer. Normally it takes up to 10 years to make a vaccine. A lot of optimism is swirling around a 12 to 18 month time frame. If everything goes perfectly, we've never seen everything go perfectly. My concern is if we rush too quickly and consider cutting out critical steps, we may not have a full assessment of the safety of that vaccine. So it's still going to take some time. I still think 12 to 18 months is an aggressive schedule.
For the point that cooperation among supply chain providers or businesses that have huge supply chains can add a lot of efficiency to the whole process.
So to be completely clear, most of this production would already be committed in contracts.
Yes.
It is almost unheard of that people are producing product without having a forward commitment for the consumption of that product. So the first thing that needs to be done, because this is not something that the countries currently control, unless countries are going to bring about emergency situations and co-opt an existing supply chain.
I had a call with Senator Schumer. He says you've now agreed to invoke the Defense Production Act to actually make those medical supplies that hospitals say are in severe shortage. So two questions. Is that what you're doing now?
It is. I did it yesterday. We do ventilators and various other things,
So
yes.
you're using it now to tell businesses that you make ventilators, masks, respirators?
For certain things that we need.
Okay. You were signing this but not invoking it. This is what you said yesterday, and that you would only do so in a worst case scenario. So are we now in a worst case scenario?
We need, no, it's no different other than we need certain equipment that the states are unable to get by themselves. So we're invoking it to use the powers of the federal government to help the states get things that they need, like the masks, like the ventilators.
Public health agencies have issued travel advisories, while some countries have banned travel from the worst affected areas. As a result, the travel sector is taking a huge hit. Travel bookings are down 45%, and many flights have been canceled. A ripple effect is racing through the service sector. Governments that rely on travel and tourism as a large part of their economies are being hit particularly hard.
So travel, we have to clarify this. Otherwise, if we go down to 20% bookings over a long period, the company will run down. That's a fact.
Well, the president said he would effort $50 billion in aid to the airline industry. The travel industry has been hit so hard, they say they need $150 billion just to survive.
We'll be experiencing, crippling losses doing that. And we know that the hotel business in itself makes up 5% of the GDP.
At most hotels with less than 20% occupancy, Marriott hotel companies started dismissing tens of thousands of workers on Tuesday. The leading labor union says nearly 300,000 hotel, restaurant, and casino workers will lose their paychecks in coming days.
We are not out of money yet, but the fact is we are trending in a dangerous direction and something needs to change.
So the policy question for this board now is how should financial resources be prioritized?
For a new COVID-19 treatment or that bailout package failed to stop the slide on the New York Stock Exchange today. The Dow closed below 20,000 as oil hit its lowest level in 18 years.
As a third of the world practices some form of a lockdown to slow down the spread of COVID-19. And all of this is having an impact on our global economy. Industries like airlines, import-export companies, tourism, retailers, events, restaurants, and many other non-essential services have been hit, some harder than others. The United Nations says we may see a $2 trillion shortfall in our global income and a $220 billion hit to developing countries.
Willing to do things that are out of their historical perspective, or for the most part, it's really a war footing that we need to be on.
We're at war. In a true sense, we're at war, and we're fighting an invisible enemy.
And quickly, a Marshall-type plan, and quickly, a Marshall-type plan, don't mean to say that exactly, but a Marshall plan that can go into effect and stimulate a change very quickly.
The process of someone on a subway, someone on a bus not wearing a mask.
Well, look, it is state law to wear a mask on public transit as a result of an executive order that Governor Cuomo issued some weeks ago. It is not optional. It is mandatory in state law to wear a mask on transit.
Countries are reacting in different ways as to how best to manage the overwhelming amounts of dis and misinformation circulating over the internet. In some cases, limited internet shutdowns are being implemented to quell panic.
With so much information out there on social media, both accurate or not, it can be difficult to find trustworthy sources of information. And what the World Health Organization is calling an infodemic about the coronavirus is, they say, just as dangerous as the disease itself.
We're concerned about the levels of rumor and misinformation that are hampering the response.
The social media platforms have to step forward and recognize the moment to assert that they're a technology platform and not a broadcaster is over. They, in fact, have to be a participant in broadcasting accurate information and partnering with the scientific and health communities to counterweight, if not flood the zone of accurate information, because to try to put the genie back in the bottle of the misinformation and disinformation is nigh impossible.
More than 40 million posts flagged by Facebook as false. It hasn't been removed, but it starts with this link to a fact check. Critics say that doesn't go far enough, as tons of misleading information is slipping through and Facebook needs to take more aggressive action. But the problem is the sheer volume of users and content. Facebook, which owns Instagram, says it does its best to ensure posts that pose a danger to people are removed quickly. Facebook also plans to start contacting people who have interacted with misleading content. And then there's Twitter. Tweets like this one claiming Bill Gates planned this pandemic through the use of 5G are rampant and hard to report to Twitter as fake. Twitter says it takes misinformation seriously.
Google, which also owns YouTube, says it's cracking down on who can use the keywords COVID and coronavirus in advertising. It also says it's moving content from reliable sources up higher in search results.
We do have, I think, a couple of strategies that are available to us, one of which is the flood strategy, second of which is relying and informing and equipping trusted sources of information with the facts so they can then pass that on.
The outcome of the CAPS pandemic in Event 201 was catastrophic. The outbreak was small at first and initially seemed controllable, but then it started spreading in densely crowded and impoverished neighborhoods of megacities. From that point on, the spread of the disease was explosive. Within 6 months, cases were occurring in nearly every country. Economists say the economic turmoil caused by such a pandemic will last for years, perhaps a decade.
Congressional Budget Office, which is nonpartisan, crunched the numbers, and they believe that over the next 10 years, this pandemic will cost our economy here in the United States $16 trillion.